All right. Welcome and thank you for joining us today for our session on metabolic health and weight optimization. And for those who are joining for the first time, I'm Dr. Shin. I'm part of the team here at the Sklar Center. My work focuses on hormones, skin, digestive health, and pediatric care. Today's webinar is really about helping you understand using evidence-based medicine, why weight loss can feel so challenging even when you're doing the right things with diet and exercise. We'll talk about why weight regulation is about more than just calories in and versus calories out. We'll break down the role insulin and insulin resistance play and how nutrition, lifestyle changes, and even GLP-1 based therapies can work together. The goal isn't quick fixes, it's sustainable long-term improvement in metabolic health. Why weight loss is so challenging. In practice, we see this all the time. People are eating fairly well, staying active, and still struggling with weight gain or weight loss. Their labs often come back normal, yet they don't feel normal. When that happens, it's usually not a lack of effort or discipline. More often, it points to an underlying issue with how the body is regulating metabolism. So, what is insulin? Insulin is a key hormone that helps control how your body uses energy. You can think of insulin like a mail carrier. It helps move sugar out of the bloodstream and into your cells, where it can be used for energy. Insulin also helps decide whether that energy gets burned right away or is stored for later, often as fat. And insulin doesn't just work in the body, it also acts in the brain. In the brain, insulin helps regulate appetite, signals fullness, and influences how much energy we burn. When this signaling is disrupted, people often feel hungrier and have a harder time regulating energy and weight. When insulin is working properly, appetite control and weight management tend to feel much easier. And what does it mean to be insulin resistant? Insulin resistance happens when the body cells stop responding to insulin as well as they should. To compensate, the pancreas releases more insulin, leading to chronically high insulin levels. This makes the body more likely to store fat, increases hunger signals, and makes weight loss much harder. Then why does insulin get a bad reputation? From a physiology standpoint, insulin resistance often develops as the body's adaptive response to long-term nutrient overload. The real problem is insulin resistance, not insulin itself. And insulin resistance usually doesn't come from just one thing. It's influenced by factors like consistently overeating, a high intake of refined carbs and sugary drinks, and gradual weight gain over time. And this is important. Insulin resistance can develop even in people who don't appear overweight. In many cases, it actually shows up before obesity becomes visible. The good news is that insulin resistance is reversible. Even small changes can make a real difference because as weight gain increases, insulin resistance, weight loss helps improve insulin sensitivity. The key takeaway is that our metabolism is adaptable and it can respond positively when we give it the right support. And long-term studies show that rising insulin levels often come before weight gain, not the other way around. When insulin stays high, the body is more likely to store energy as fat and send stronger hunger signals. Over time, this makes future weight gain much more likely. Leptin is another important hormone that helps regulate long-term energy balance and signals fullness to the brain. When we cut calories or lose weight, leptin levels naturally drop. This makes us feel hungrier and causes the body to conserve energy by slowing metabolism. Insulin is closely connected to leptin. It helps regulate how much leptin is made and how well it works. So these two hormones are very much linked together. What is GLP-1 and why is everyone talking about it? GLP-1, short for glucagon-like peptide 1, is a hormone made in the gut. It helps the body release insulin when blood sugar is high, slows down how quickly food leaves the stomach, improves how sensitive the body is to insulin, and helps you feel full. Together, these help keep metabolism and blood sugar in balance. Certain medications called GLP-1 receptor agonists, and in some cases, dual GIP and GLP-1 agonists, are recommended by groups like the ADA, American Diabetes Association, because they can help control blood sugar and support weight loss. Some examples are semaglutide, liraglutide, and tirzepatide. How these therapies are used is personalized based on each person's unique health needs and their response to these peptides. Unlike many weight loss approaches, GLP-1 based therapies can improve insulin sensitivity even before you lose weight. They work both in the brain, helping control appetite, and in the body, improving how glucose is used. So the benefits support long-term metabolic health, not just short-term appetite suppression. So what exactly are peptides? Peptides are short chains of amino acids that act as signaling messengers in the body. They help different systems communicate with each other. Some peptides are naturally produced by our bodies, while others are used therapeutically. GLP-1 is a good example of that. Another medication that can help improve insulin sensitivity without causing significant weight gain is metformin. Metformin has been shown to lower fasting insulin levels and for some people support modest weight loss as well. While both can support insulin regulation, metformin works more at the level of glucose metabolism, whereas GLP-1, it also influences appetite and satiety. When it comes to nutrition for metabolic health, the focus is really on whole foods, getting plenty of fiber, and cutting back on refined carbohydrates. Research consistently shows that a low glycemic, high fiber diet can help reduce blood sugar spikes and also support sustainable weight loss. Several eating patterns can also work, including the Mediterranean diet, DASH diet, so that's short for dietary approaches to stop hypertension, plant-forward approaches, or even lower carb diets. What matters most is finding a plan that's flexible and sustainable for you. The goal is to reduce blood sugar spikes and insulin surges after meals while still enjoying your meals. And research shows that simple strategies like eating vegetables and protein before starches, keeping regular meal times, avoiding late night eating, and even drinking 1 tablespoon of apple cider vinegar diluted water 15 to 20 minutes before meal can help improve blood sugar and insulin responses. These small changes are often more effective and easier to stick with than strict restrictive diets. And exercise plays a powerful role in metabolic health, even when the scale doesn't change. Both aerobic exercises and resistance training improve insulin sensitivity by increasing glucose uptake in muscle. It helps reduce visceral or belly fat and lower the risk of cardiovascular and metabolic disease. So these benefits occur independently of weight loss. And in terms of how much activity is needed, research shows that aiming for at least 150 minutes per week of moderate intensity movement is enough to see meaningful metabolic improvements. This can include a mix of cardio, strength training, and even consistent brisk walking. The best long-term results for weight and metabolism come from approaches that are maintained over time and supported with professional guidance. Combining lifestyle changes with the right medical therapies allows for a plan that's more personalized and sustainable and giving you more lasting benefits. In summary, weight is influenced more by metabolism and hormones than by willpower alone. Insulin resistance is common, has a biological basis, and the good news is it's reversible. With the right assessment and a plan tailored to you, meaningful and lasting improvements in metabolic health are definitely possible. What to nurture this month? This month, let's try to focus on supporting metabolic balance through nourishment, movement, and rest. Start by paying attention to what you eat. Aim for balanced meals with enough protein, fiber, and healthy fats. And let's try to reduce sugary drinks and refined carbs. And notice how different foods affect your energy, hunger, and cravings. When you when you eat matters as much as what you eat. Consistent meal timing helps your insulin and energy stay balanced. Prioritize earlier meals when you can and try meal sequencing, vegetable first, then protein, then starch to help manage blood sugar without strict dieting. And eating slowly and without distraction gives your body time to recognize fullness. Leaving enough time between meals also supports satiety, helping prevent overeating and reducing metabolic stress. Movement is key too. Regular physical activity improves insulin sensitivity even if you don't lose weight. Aim for at least 150 minutes of moderate activity per week. Include resistance or strength training 2 to 3 times a week. Finally, sleep is equally foundational. Consistent sleep and wake time support hormonal balance and metabolic resilience. Try to avoid late night eating as digesting food close to bedtime can interfere with sleep quality. Alrighty, I know that one was a really short one. Any questions or comments or concerns? I don't see it. Let me stop recording.